Welcome to the Produce Moms Podcast, where we believe there is a produce mom in all of us. I'm Lori Taylor, founder and CEO of the Produce Moms. For 10 years, I sold fresh produce to over 300 grocery stores in the U.S. And today, my team and I are fully focused on inspiring people to eat more fruits and vegetables. This show is just one of the ways that we hope to inspire you and your family to eat more produce and live a better life. If you like what you're hearing on the podcast, join our community of almost 40,000 in all 50 states and over 30 countries by visiting theproducemoms.com/subscribe. And be sure to subscribe and leave us a review on iTunes. Thanks for being here. Enjoy today's show. Welcome back, everyone. This is the Produce Moms Podcast. My name is Lori Taylor, and I am thrilled to welcome today's guest. We are joined today on the show by Emily Brown. Emily is the founder and CEO of the Food Equality Initiative. Food Equality Initiative is the nation's leading organization that is working to increase access to allergy-friendly and gluten-free foods to individuals who need them the most. We are going to learn a ton in this episode, and I am extremely thrilled and honored to welcome Emily to the show today. Emily Brown.
Thank you for having me today. I'm so excited to have this conversation.
Me too. And, you know, Emily, I really just found your work through LinkedIn. I was not familiar with the Food Equality Initiative until I started following you on LinkedIn and became pretty passionate about what you do. I have a heightened awareness of the struggles associated with food allergies from the women on my team educate me. We've got a couple children with of Produce Moms employees that have extreme peanut, tree nut, eggs. My mother is a celiac. She battles with celiac disease. And my nephew has a very severe peanut allergy. He just went through the desensitization treatment at Cincinnati Children's Hospital, and thankfully it worked well for him. But there's so much to be learned. And I also was really intrigued with what I learned about the 7% fund and statistic. So I'm hopeful that we can talk more about this. And that 7% statistic is 7% of Black children are 7% more likely to have food allergies compared to white children. And I had no idea. And I think just as society has become more heightened with racial and social justice, that was something that it was powerful for me to learn that through your organization and movement too.
Yeah, it's one of those things. I feel like, we're all living in this post-COVID, post-George Floyd world. And I think our eyes have been opened to so many things. And particularly when it comes to health equity and disparities in the Black community, and the food allergy community is no different. We certainly have disparities in the food allergy community, and what once was thought of as a more affluent, mostly white disease is actually more prevalent in Black children and other minority groups. And so, it's important for us to have these conversations so that there can be some level of heightened awareness, and so that we have the opportunity to, close those disparity gaps and, work toward a more equitable community where everyone can thrive.
Yeah, definitely. Food and proper nutrition and access to the most wholesome food on the planet, specifically fruits and vegetables. Emily, from us being connected, that's one of my top passions and priorities at the Produce Moms. So let's start off the show today with just telling our listeners a little bit more about yourself and your background, please.
Yeah, so I'm a mother and a wife. I live in the Midwest here in Kansas City, but I'm originally from Dallas. I have two girls, both who have food allergies. They're both managing peanut and tree nut allergy. And then my youngest also has a disease called eosinophilic esophagitis, or EOE, which is a food allergic condition that causes the white blood cells, the eosinophils, to build up and congregate in the esophagus and throughout the GI tract. So because of that, my family has been greatly impacted by food allergy. I tell people all the time that, it has had a profound impact on our quality of life. And so it's really kind of changed the trajectory of my life. I wake up every morning and I work on behalf of, families all across the United States who are impacted by food allergy or celiac disease and need access to safe and healthy food. My background, I taught preschool for a year before I had my girls. And so, I just come to this work with lived experience and passion.
Yeah, I love that. So tell us more about what the Food Equality Initiative is all about and when you founded it, the timeline associated with this movement, and why it's here, why it's necessary.
Yes, of course. So I started Food Equality Initiative almost 6 years ago. It's hard to believe it's been that long, but it really came out of my family's personal experience with food insecurity and food allergies. Like I said, I have 2 daughters. They both have food allergy. But when my oldest daughter was 1, she was diagnosed with multiple food allergies. She was allergic to milk, eggs, wheat, soy, and peanuts. And as you can imagine, it changed our lives. And, overnight, our grocery bill quadrupled. And
Sure.
so just to give your listeners an understanding, if you're not familiar with allergy-friendly or gluten-free foods, they cost 2 to 4 times that of those that contain common allergens. So I'll give you an example of milk. So a regular gallon of milk here in Kansas City costs almost $4 a gallon. But if you have to have a specialized kind, a non-dairy version, you're going to pay anywhere from, $6, $7, even as high as $15 per gallon. And, the dairy alternatives are typically not sold in a gallon. It's sold per quart. But when you add up the cost per quart, that's what you're paying. And so, how can a family who was struggling to pay $4 now afford $15? It's just, that's difficult for a middle income family to absorb, but impossible for an under-resourced family to absorb that cost. And so very quickly, my family began to struggle. At the time, I was planning to go back to work as a preschool teacher. I was going to take my daughter with me. And, she had so many allergies that we weren't, she wasn't able to come and come to work with me. And so, then I wasn't able to go back. And so it's just this kind of domino effect, that happened and happens to so many people, particularly we're seeing now with COVID-19 and so many people experiencing unemployment and economic instability. Sure. Perhaps
heightened food insecurity. Yeah.
Yep. Yeah. So, for us, it happened fairly quickly. And, then we found out we were expecting our second child. And, my husband, being the social worker, was like, you need to enroll in WIC. I tell people to do it all the time. And so I enrolled in WIC and quickly realized the foods that we needed were not available there. So WIC does make some substitutions for common allergens, but it's a very restrictive program, specific brands, specific quantities, and what we needed we just couldn't get. And so I started calling around and was told to go to my local food bank, called my local food bank, and they said no. We're opening big bags of flour. There's not a clean room. You should go to a local pantry. Right. Maybe somebody's rescued something from Whole Foods or a local natural store. You might be able to find something. Stood in line for over 2 hours. And when I got into shop, there were only 2 potatoes and a jar of salsa. Those were the only safe foods. So, in that moment, I was very grateful for that. But at the same time, it was really a shock. Here I was, really dealing with an unmet medical need.
Mm-hmm.
The insurance was paying for the emergency epinephrine, and we were told to avoid the food. So food avoidance was the treatment. And so therefore, food was not just a means of sustenance. Having the right food at the right time was truly part of the treatment. Yet it was not covered by insurance and completely inaccessible to me through the federal nutrition programs and through, what is commonly called the charitable food programs, or like food pantries and soup kitchens and food banks.
Sure.
So it wasn't there either. And because of food deserts and, lack of resources, if I found it in my county, it cost more. And oftentimes I would have to drive to a whole nother county to find the food that we needed. And so I just knew we couldn't be the only family dealing with this, that this just needed more attention. And so, FEI's work initially began in policy. And so I was committed to working to change the WIC food packages. And right when FEI started, they started the last food package review. And so quickly we began, to organize a comments campaign. I spoke at their national conference, started working to build, a base of coalition support, and quickly realized that I might be working on this till my kids have kids, because they only review the packages every 10 years. And it's unlikely that I would get what I wanted on the first go round. And so while I'm proud to say that we did make a small change during that first review, they acknowledged there was no substitute for fish and no substitute for egg in the package. I knew that we have a long way to go. So I knew that we had to have some type of direct services approach, which would, one, allow us to start helping families today, and two, allow us to build the data infrastructure and partner with research institutions to drive the data that we needed, the high quality data that we needed to really make long-term policy changes. And so we opened the nation's first allergy-friendly, we opened the nation's first allergy-friendly and gluten-free food pantry here in Kansas City in the spring of 2015.
Wow.
So, we've been serving families here in Kansas City ever since.
And how has that model been received by your local community? Is it a model for national growth or expansion?
Yeah. So we initially began with a model that we called a pantry within a pantry model. So we didn't build freestanding pantries. We partnered with the existing organizations that did pantry. We negotiated for a certain amount of space through an MOU process. And then we would stock those shelves and provide training and support to their volunteers and staff to do that distribution. And then FEI would maintain relationships with the brands and food manufacturers who were donating to the program, and then also maintain the relationship with the referral partners, which were hospitals and clinics, because the service is prescribed. Everyone who receives service has a prescription diet order form from their doctor. So we managed all of that, so that the pantries wouldn't have to deal with HIPAA compliance and all of that. And so that kept our costs down low. But what we started to realize rather quickly was that while our costs were low, there were three barriers that made it difficult for this model to scale and for it to grow. And that was, pantries are inherently difficult to access for a number of reasons. The first being time. They're typically open limited hours every week. And so many of the families that we served were, working families that needed to go to work, that couldn't miss their shifts. And so then they couldn't make it to the pantry. The additional barrier was transportation. And so we initially opened several locations all over the Kansas City metro, but continued to find it difficult for families to make it to the pantry. And then the third is stigma, because, unfortunately in this country, there's still stigma associated with utilizing a food pantry or food bank, and shame, there being shame around that. I personally think it's very brave to say I need help. But, it's one of those things we haven't normalized. We don't talk about it. And so because we don't talk about it, there's just a lot of shame. So we started looking for other models and, testing different models throughout the years. So in 2018, we tested a voucher with one of our brand partners that would allow our families to access that product in their local store, because this brand had very wide retail distribution. And because of that, it could be found not only at specialty grocery stores, but kind of your more traditional grocery outlets, and then also including Target, Walmart, and CVS. And so we felt initially that this would allow our families to have more dignity of choice. So, they would be able to get any variety of this product that they wanted or that they needed. They would also be able to get it on their own time. And so they would receive the voucher when they came to the pantry and then pick it up on their own time. Well, it was great in theory, but in practice, redemption of the paper vouchers were between 10 to 20%. And so we did this for an entire year. And, our families, they would lose them, and, there's just a number of reasons why it didn't work as well. But then we also tested it with another brand who didn't have wide retail footprint. And so they had a great e-commerce store. So they gave our clients a special code. They ordered what they needed online, and it was shipped directly to their door. No cost to them. And that was very well received, over 80% redemption. And when we, followed up with our families and asked, okay, why did you redeem this voucher over the other one? And overwhelmingly, it was the convenience of being able to order online and have it delivered direct to door, there being no shame having to use a voucher or coming to the pantry. Overwhelmingly, it is what our families wanted. And so we spent all of 2019 trying to fundraise a proposal to try and move to a direct-to-door model. And quite frankly, we were unsuccessful in 2019. But then 2020 happened. And we received a little bit of funding right at the beginning of the year. And then COVID happened. And so we, I just made a decision, the right thing to do is to move to the direct-to-door model, because we know that that's the one that our families want. We know it's efficient, effective. And, with many of our families managing not only food allergy or celiac disease, but also potentially other autoimmune conditions, they really didn't need to come out and sit in lines. And so, we made a quick pivot. And so we've been doing direct-to-door model since the beginning of COVID, and it's here to stay. We're not going back to the pantries. And in fact, we've brought on a logistics partner. And so we are now positioned to scale our direct-to-door model across the country. And so, our site is going to change in the next month, 4 to 6 weeks. We're launching a new site. And then our families will be able to basically order what they want online and have it shipped direct to door. So we think it'll be transformative, innovative in that, most food assistance organizations, have pivoted to drive-through distribution. And we said, if the house is on fire, let's not rebuild the same kitchen we had before. Like, let's the one we know we want, So, I hope that when we launch it, that people see it as such, and that it truly is a model that will be able to scale nationwide and, meet a need that we know exists in every community and every county across the country.
Yeah, absolutely. And wow, what a pivot, what a story, what a heritage. I'm so glad you shared all that. I think it's pretty obvious after sharing those sentiments what the Food Equality Initiative does. Prior to you explaining everything, I almost would have pegged the Food Equality Initiative as being a conduit or a connector of resources for folks, and also, a catalyst for public policy or public-private partnerships. But now you're really an end-to-end fulfillment solution for households with this new direct to consumer or direct to door model.
Right. I mean, I'd say we're a mix of both. I mean, we are a solution, an end-to-end solution, but we continue to say that it's not enough, that's not enough, that we've got to continue to push for policy changes so that we can see the type of systemic barriers that have existed for so long break down, and we can truly see the equity that we know that we need to see. I mean, right. I often think, like, where do I want us to be in 2020 or 2030, like 10 years from now? And I want us to have, made a quantum leap forward in, closing these disparities, these racial and economic disparities in food allergy. And I know the only way we're going to get there is that we take bold and innovative ideas and solutions and implement them, but that we also look at the policies that are driving the inequity and that we address those. So,
no, it's great. And, when you visit your website, foodequalityinitiative.org, one of the images that greets you is a grocery bag full of fresh produce. And the tagline that appears right there on the homepage: leading the free from food access movement. Tell us a little bit more about the role of fresh produce in the free from food access.
Yeah, we believe that having access to fresh produce is vitally important for health and wellness, and a very important part of the free from diet. And so we have made a commitment to local fresh produce in our program. So our families, we support a local farm collaborative here in our region. And as we hope to scale, we hope to develop relationships with farmers across the country because we believe that having access to good, high quality produce is important. So we, like I said, we make a commitment to that. And so our families not only receive, the free from substitutes that they need to make healthy meals, but they also receive fresh produce. It's very important.
Yeah, I love that. And when you say free from food, let's identify what exactly that concept means to our listeners.
Yeah, so that is a relatively newer food industry term. And it's one that we began using a few years ago because we felt it more encapsulated the work that we do. And it was just a lot easier than saying allergy friendly and gluten-free. So it was just a catch-all catch-all phrase for, dairy free, soy free, peanut free, tree nut free, so we just say free from. And so, we're distributing foods that are free from common allergens.
Okay, thank you. And how has the COVID-19 pandemic contributed to food insecurity? I mean, I think we kind of touched on this, how it's a very food insecurity is a very circular effect with rising unemployment. But is there anything else that you would like to share? I mean, I know in a way, the pandemic served as that catalyst for you to make the pivot to the direct to consumer model. But anything else you'd like to share on that?
Just that COVID, I'd say, we had these plans before COVID began, but I would say COVID was definitely a catalyst or an accelerator. Mm-hmm. And I would say that's true in our business, and I would imagine in many other businesses.
Oh yeah, we've seen it. We've seen it big time in farming too. The fresh fruit and vegetable growers that we work with, a lot of them have rolled out direct to consumer models when, or even at grocery retail, strategies that surrounding the online grocery shopping experience, where people thought it was going to be more of an issue in, like, gosh, I don't know, 10 years from now, or something that's more of a critical need 10 years from now, all of a sudden became an overnight critical need because of COVID.
Right.
Well, Emily, this has been such a great conversation. I truly appreciate your time and your work. Most importantly, your very important work. I want to make sure that folks know they can visit foodequalityinitiative.org to learn more about what you do. Obviously, everyone, you can connect or follow along with what Emily shares on LinkedIn. That's how I discovered this great organization. So please connect or follow with Emily on LinkedIn, Emily Brown. Emily, any closing thoughts? Before I throw the mic back to you, thank you one more time for what you do and for being our guest.
Oh, well, thank you for inviting me here. And, I guess my final thought is just that we are in such a pivotal moment in our time with, like I said, we're living in this post-COVID, post-George Floyd world. And, I think it's going to take all of us to make this more than a moment and to make it into a movement. And so I just ask all listeners to do what they can in their own community to kind of bridge the gap in equity.
Thanks for joining us on this episode of the Produce Moms Podcast. If you or someone you know would like to be a featured guest, just send an email to Lori@theproducemoms.com. We know there is a produce mom in you because there's a produce mom in all of us. Join our community on Facebook and all social platforms. Help us change the way America eats. Thanks again for listening, and we'll see you next time.